dear postgraduates, so today's talk will be on wonder vitamin and also a hormone, that is vitamin D3. Okay, so you all know that vitamin D3 is very, very important for our body's functions, and it has been involved in many diseases as it's very much associated with the diabetes, hypertension, metabolic syndrome, malignancies, and of course osteoporosis, calcium metabolism, phosphorus metabolism, hyperparathyroidism, skin problems, okay, or immunity, or your COVID-19, etc. So with this background, we will move on to the topic proper to know much about the vitamin D3, which is very, very important vitamin nowadays. It reverses the rickets, a softening of the bones in the children and osteomalacia. So there is a rickets in adults. So if you see the vitamin D3 levels, if it is less than the 10, so there may be a higher possibility of getting the rickets in the children and osteomalacia in the adults. So I don't spend much time on the rickets, but one thing is very clear that predominant cause is poor diet and also lack of exposure to the sunlight. So the vitamin D3, we get it from the sunlight about 90% and about 10% from our food sources. So sunlight plays a major role. So to get them appropriate vitamin D3 in our body, 90% sunlight and 10% is the food. And most of the vegetarian food, they don't contain the vitamin D3. So that is the reason supplementation of the vitamin D3 is very much needed for all the vegetarians and the vegans. Cod liver oil, fish oil, egg yolk. So these are all very much associated with the vitamin D3 as it's an important ingredient, and it has been used medicinally since the years early 1800s. Malnourished children were cured with the whole milk, fortified with the vitamin D3. Now the milk is fortified with the vitamin D3. Yogurt is fortified. Cereals are fortified. So the fortification of vitamin D3 is also there. So that will help our people not to have the vitamin D deficiency. So for this wonder vitamin and the hormone, the Nobel Prize was given in 1928 to Adolf Windaus for his studies on the constitution of the sterols and their connection with the vitamin. See, the vitamin is a fat-soluble vitamin. Vitamin D3 is a fat-soluble vitamin. So here, Adolf Windaus in 1928, so he got the Nobel Prize for this discovery of the vitamin D3. Other scientists before and after contributed to the current understanding of the vitamin D functions in the body and relates to our human health. So what is vitamin D? So by definition, vitamin is a substance regularly required by the body in the small amounts. The body cannot make it on its own. It's required to be supplied by the daily diet. So luckily vitamin D, is plenty of the vitamin D is in the sunlight. But unfortunately, even though the Indian population, even though it's the hottest season, most of the Indians are vitamin D deficient, nearly 75 to 80%, because of the improper exposure to the sunlight. So to get the vitamin D, the ideal time of the exposure must be between 10 a.m. to 4 p.m. And there should be a minimum period of 30 to 60 minutes exposure to the sunlight should be there. So between these times, most of the people, they use the sunscreens, they use the hats, they use the umbrella. So most of these people are the motorization. So exposure to the sunlight is not there. So that could be the reason for the Indians, even though the tropical country, lacking vitamin D in nearly 75 to 80% of our population. See, these are the food sources, cod liver oil, salmon, mackerel, sardines, less amounts from the whole milk, cheese and eggs. That is the reason now we are the fortified these foods. And some foods such as the milk, cereals, orange juices, they are now fortified with a small amounts of the vitamin D to prevent the rickets. So this is also a hormone. It can be made by the body rather being absorbed just from the food. So almost 90% from the sunlight and from your skin. So the skin contains one cholesterol, 7-dehydrocholesterol. So on exposure to the sunlight, this will be converted to the pre-vitamin D3. So this pre-vitamin D3 will be converted to the vitamin D3 with the prolonged exposure to the sunlight by having the more and more heat on the skin So that conversion of the pre-vitamin D3 to the vitamin D3 will occur in the skin itself. So once the vitamin D3 is formed in the skin, so that will reaches to your capillaries and then reaches to the liver. So in the liver, hydroxylation will take place. So that will be formed as the 25 hydroxycholecalciferol. And again it touches to the DBD, that is the vitamin D binding proteins. Then it goes to the kidneys, where further hydroxylation takes place, and then you will have the most active form of the vitamin D3, 125 dihydroxycholecalciferol. So that is how the vitamin D3 formed in our body, most active form from the skin as the 7-dehydrocholesterol, and then the pre-vitamin D3, then the vitamin D3, then it attaches to the vitamin D3 binding proteins, enters to the liver, hydroxylation takes place to form as the 25 hydroxycholecalciferol, and then it enters to the kidneys, and then it will become a most active form of the vitamin D3, 125 dihydroxycholecalciferol. So that is the thing. So this is the also a hormone, because the body makes its own. The three important forms of the vitamin D in the body: vitamin D3, that is the cholecalciferol, 25D calcidiol, 125 dihydroxycholecalciferol or calcitriol. Okay, so that is the reason in most of the CKD population who use calcitriol, 0.25 mg, 0.5 mg, etc. Okay. So vitamin D3 or the cholecalciferol is made in the skin after exposure to the sun, non-toxic. Once you have made 20,000 units, a mechanism in the skin destroys the excess amounts. Calcidiol, a pre-hormone made from the vitamin D3 in your body. This form helps the body absorb the calcium and maintain the healthy bones. So that is the interplay between the calcium, phosphorus and vitamin D3 to make the bones healthy. So what happens in the absence of the vitamin D3? Absorption of your calcium and the phosphorus from the intestines will be lagging behind. So the poor absorption of the calcium and the phosphorus from the intestines because of the deficiency of the vitamin D3 leads to hypocalcemia and hypophosphatemia. So because of this hypocalcemia, so it stimulates the parathyroid hormones to release more and more parathyroid hormone. So you will have a secondary hyperparathyroidism because of the hypocalcemia and hypophosphatemia because of the vitamin D3 deficiency. Okay, and this high PTH, it will make the bones more and more resorption, more turnover, and finally that leads to fragility of the bones and fractures because of the osteoporosis. So last class we discussed about the bone resorption and the bone formation, osteoclasts and osteoblasts. So this PTH will make the bones more fragile because of the more and more osteoclasts activity, bone deforming activity. So that's how the hyperparathyroidism will make you more and more osteoporosis. 125 dihydroxycholesterol or calcitriol, a steroid hormone also made from the vitamin D3, manufactured in the many cells, tissues and organs in the body. Earlier we thought that 125 dihydroxycholecalciferol is formed from the kidneys alone. Now not only the kidneys, almost all the tissues in the body and also almost all organs in the body will make your 125 dihydroxycholesterol. That is the most active form of the vitamin D3. So this form helps the intestines absorb more calcium and the phosphorus. So they won't have any hypocalcemia or hypophosphatemia, and your THS levels, your parathyroid hormones will be at normal levels. Otherwise, these parathyroid hormones will increase because of hypocalcemia and hypophosphatemia. Since this form comes from the kidneys, a 125 dihydroxycholesterol test does not reflect how much vitamin D3 is in other organs and should not be used to measure healthy circulating levels of the vitamin D3. So this is what this is a good diagnostic representation here. Leads to the other forms that can create the healthy bones, prevent the cancer, and much more. So more than the cancer. So after all the diseases I told you, there are some autoimmune diseases or some immune mechanisms. Okay. So these are also helps you. So here the sun, you'll have the skin. So skin will make the hydroxylation and will make the vitamin D3. That vitamin D3 goes to the liver. So hydroxylation takes place. Then it goes to the kidneys and 125 dihydroxy whole cholesterol will form. That is the most active form. So that will reach to your bones, calcium, absorption and parathyroid hormones, blood pressure control, blood sugar control. So that also helps in your diabetes and hypertension and metabolic syndromes. Okay. So here from the liver, so that may goes to the breast, colon, prostate, immune cells, etc. in reducing the cancerous of these organs. So nearly 17 to 18 cancers will be prevented with the vitamin D3 injection. See, that affects the genes also. So the cancer protection, tissue and organ health. So these are all the advantages of the vitamin D3. So it's a very, very aptly say that it is a wonder vitamin and also a hormone. Vitamin D1 is found to be a mixture of the compounds rather than the vitamin D product. A term no longer used, vitamin D1. Vitamin D2 is ergocalciferol, produced by the plants and the fungi when exposed to the sunlight, not produced naturally in the human body. It is similar but not identical to the vitamin D3, less potent and less effective than the vitamin D3, yet is still prescribed by many doctors. So vitamin D4 and the D5 derivatives of the vitamin D3. So don't bother about the D4 and the D5, but the D1, D2, D3 you should understand very much. What is the role of the vitamin D? So the major biological function of vitamin D is to maintain the normal blood levels of the calcium and the phosphorus. So I told you the interplay between the calcium, phosphorus and vitamin D will lead to osteoporosis and bone fragility. See, the healthy levels of vitamin D in the blood help the body absorb the calcium to maintain the strong bones. So the rickets, I told you, the softening of the bones in the children and can cause the skeletal deformities. It is due to the vitamin D deficiency. In osteomalacia, the muscle and the bone weakness in the adults is due to the vitamin D deficiency. So what is rickets in children is osteomalacia in the adults. Additional research suggests that healthy levels of vitamin D also aid in the treatment or the prevention of many other diseases like osteoporosis, cancer, I told you several cancers, diabetes, hypertension and metabolic syndromes and autoimmune diseases and simple influenza and also your COVID-19. So, or even in the neurological diseases like your Parkinsonism or dementia, Alzheimer's disease, or in CVA. So, this is very much related to vitamin D deficiency. So, there are the levels of the vitamin D and how it relates to the vitamin D deficiency. See the severe deficiency. It is less than the 10 nanograms per ml. It is a very, very severe deficiency. These people will may lead to the rickets and the osteomalacia. What you mean by the deficiency? It is a 10 to the 20 nanograms per ml. Severe deficiency less than that 10. Okay. Insufficiency 20 to 30. Normal 30. Maybe 30 to 100. Okay. So 40 to 70 is the optimal. And over 90, over 100 is the overdose. And over 150 is the toxic. So the most of the people, we are having the vitamin D deficiency. So that means not normal. So less than the 30. If it is less than the 30, we consider as the insufficient. If it is less than the 20, we consider the deficient. And less than the 10, we consider the severe deficiency. So remember 10, severe deficiency. Up to 20, deficiency. Up to 30, insufficiency. Okay. 30 plus normal. And up to 100 is okay. And more than the 100 is the overdose. And more than the 150 is the toxic. So nowadays, with the good understanding of the vitamin D, D3, we are writing a lot of the vitamin D3, 60,000 international units, once in a week for 8 to 12 weeks, and then once in a month. Some of the people know. So instead of changing from the 12th week to once in a month, they may be using the once in a week for a very longer period. So that will lead to toxicity. So vitamin D toxicity is a big problem nowadays because of the ignorance of the population and because of the poor understanding of the dosage of these drugs. So how will you define the toxicity of the vitamin D3? So the vitamin D3 toxicity will have a nausea, some vomiting, some muscle weakness, some ataxia, arrhythmias, weakness, sleeplessness, So these the vague fatigability. So these are all very, very common features of the vitamin D toxicity. So whenever you have these people with a say chronic fatigue syndromes, etc., so better to check for the vitamin D history of the vitamin D intake. So if the person is asked taking that vitamin D once in a week for about 20 weeks or 30 weeks for the last 1 year, so it should be because of the vitamin D toxicity. The prevalence of the inadequate vitamin D, as already I told you, a lot of the people in the world are the vitamin D deficient, and even in India, even though we are the tropical country, because of the improper exposure to the sunlight by most of the Indian population. So 50 to 60% of the older population in the world, they do not have the satisfactory vitamin D status. Maybe because of the urbanization, decreased outdoor activities, air pollution, global dimming, age-related decrease in the cutaneous vitamin D production, and also maybe because the skin is thick or dark skinned. So again, that could be the synthesis will be lessening. So the poor synthesis of the vitamin D because of the dark skinned are in the elderly individuals. So the dietary sources of vitamin D are generally too insignificant. I told you that diet contains only 10%. Most of the vegetarian diets, they don't contain vitamin D. There must be a fortification of the vitamin D3 in the foods must be there. So these are some of the reasons for our dietary deficiency. 36% of the otherwise healthy young adults, they looks like young, they looks like healthy, but if you check the vitamin D3 levels, they are deficient or insufficient or severely deficient. So maybe less than the 10, maybe less than the 20, maybe less than the 30 is very common in our young adults because of these reasons. The pregnant women and the neonates, again, 90% taking the prenatal vitamins, 54% pregnant black women and 46% black neonates, they are vitamin D3 deficient. So these are the very common. See, you need not remember these figures, but one thing is very clear that it is a ubiquitous disease. This disease is very common in the young adults, very common in the pregnancy, very common in the lactation, very common in the young adults, common in the adults, common in the elderly population. So because of the several reasons. Okay. So this vitamin D3 as a medicine postgraduate, we should know everything about the vitamin D3. For that matter, we should know everything about the commonly used drugs nowadays. See, vitamin D3 is a very, very common prescription by the orthopedics, very common prescription for the neurologists, very common prescription for the endocrinologists, and very common prescription for the physicians. Okay, so up to 50% of the general medicine inpatients in the United States are having these things. So children and the vitamin D deficiency is very high. It's a worldwide problem, not a national problem. It's a global problem. So vitamin D deficiency in the pregnant and the nursing mothers is very high. Again, deficiency, vitamin D3 deficiency and obesity. Obesity. Okay. See, the vitamin D is a fat soluble and is therefore stored in the fat cells. Obese individuals have more fat cells to collect the more and more vitamin D. As a result, there is a less vitamin D available to the kidneys and intestines, and therefore less calcium is available to maintain the strong bones. So they looks like obese. Obesity means increase in the fat cells. So increase in fat cells means increase in vitamin D in the cell, within the fat cell, because it's a fat soluble vitamin. So the less vitamin D is available in the outside the fat cell. So that is the reason these people will be having the vitamin D deficient and hyperparathyroidism at a later stage. Correlation between obesity and the vitamin D deficiency related osteomalacia. A study in UK found that the levels of the postmenopausal women were lowest in those with the highest mass index. Now the vitamin D deficiency in the elderly population. So we discussed about the vitamin D deficiency in the children, in the obese, in the pregnant women, and now in the elderly individuals. More than half of the Americans, more than the 65 years are the deficient, putting them at risk for the more bone fractures. Last class we discussed about the senile osteoporosis. Osteoporosis is divided into two groups, 1 and 2. So in the 1A is postmenopausal and 1B is senile osteoporosis. Okay, so 50% have the less than the 30 nanograms per ml. As people age, they lose muscle mass and also the strength. So sarcopenia. So sarcopenia is very common in the elderly individuals. So again, the vitamin D3 deficiency could be a reason for your sarcopenia. This weakening can lead to an increased risk of the falling. By age 65, 1 in 3 people fall each year. By age 80, 1 in 2 people fall each year. So because of the severe osteoporosis, so because of the vitamin D3 deficiency, making calcium and phosphorus poor absorption from the intestines, making them hypocalcemic and hypophosphatemia. Now the vitamin D deficiency in the other diseases. Okay, it's a fat soluble. People who have the illnesses that prevent them from absorbing could be at risk for vitamin D deficiency, like Crohn's disease, or ulcerative colitis, or inflammatory bowel disease, cystic fibrosis, those who have undergone the gastric bypass surgery, liver or the kidney failure, impairs the ability of these organs to process the vitamin D. See, I told you the why liver and kidney is very much needed for your hydroxylation of the vitamin D3 in the liver, and then further hydroxylation to make it as most active form in the kidney. So in both the hepatic failure and the kidney failure, renal failure, so there will be the deficient vitamin D. See other cases also, the absorption from the intestines, but the food absorption. So again, all the intestinal diseases like your gastritis or your gastric bypass surgeries or your malabsorption syndromes or inflammatory bowel diseases like your Crohn's disease or ulcerative colitis. So these are all very much involved in vitamin D deficiency. What about the cancer? 60,000 premature deaths from cancer are 10% of the total cancer deaths. Okay, 7,000 premature deaths. See the premature deaths due to the cancers in thousands of numbers. This is all because of the maybe one of the important factor for this is vitamin D3 deficiency. 403 post-menopausal women over a period of the 4 years they studied. Those taking vitamin D and the calcium had a reduced risk of any kind of the cancer by 77% compared to those receiving the placebo. So those people who are taking the vitamin D and the calcium had reduced risk of any kind of the cancer, whether it is a breast cancer or ovarian cancer or uterine cancer or prostatic cancer, etc., etc. About 75% risk reduction. So very good risk reduction is possible with the vitamin D supplementation in this population. So retrospective studies, people living at higher latitudes are at high risk of developing the cancer because of the poor vitamin D3 at high altitudes. Seasonal studies show that people diagnosed with the cancer, colon, breast, prostate, in the summer or the fall had a better chance of survival than those diagnosed with the cancer in the winter or the spring. So winter or the spring, poor exposure to the sunlight. Okay, so there will be the less amount of the vitamin D3 in these seasons. So that season they have the poor survival when compared to the summer where a good amount of the vitamin D3 is produced from the skin. So reduction of the about 17 different cancers. So this number may be increased. And need not be always the 17, maybe 27, maybe 37, maybe all cancers. Say the breast, colon, prostate, bladder cancer, esophageal cancer, gastric, ovarian, rectal, renal cell carcinoma, uterine, cervical, gallbladder, laryngeal carcinoma, oral cancers, pancreatic carcinoma, both Hodgkin's and the non-Hodgkin's lymphoma. So these all have been associated with the vitamin D deficiency. Now move on to the cardiovascular health. Okay. So the heart attack, hypertension, congestive heart failure, peripheral vascular disease. So these four contains are very, very important vascular diseases. So vitamin D3 deficiency will be associated with the heart attacks, with hypertension, with heart failure, and also with PVD. So the men deficient in the vitamin D less than the 15 nanograms per ml for 242% more likely to have a heart attack compared to the men with 30 nanograms per ml circulating the vitamin D. Okay. So the less than the 15 in the men are more likely to have a heart attack as far as the vitamin D is concerned when compared to the people with the 30 nanograms per ml of vitamin D3. Men with the lower levels between 22 to 29 are still at a heightened risk compared to those with the 30 nanograms. Okay. So you should have a normal vitamin D3 to avoid the premature myocardial infarctions as far as the vitamin D connection is concerned. Even at the less than the 30, more chances of having the heart attacks. What about the hypertension? Less than the 15 nanograms per ml were 3 times more likely to have the diagnosis of the high blood pressure compared to those with the 30 nanograms. Okay, so 3 times higher risk of having the hypertension once the vitamin D3 levels are at 15 nanograms when compared to your normal of 30 nanograms per ml. Then move on to the heart failure. The Li levels were 50% lower than those people with a healthy heart. So the heart failure people, about the 50% of the people are having the low vitamin D3 levels when compared to the normal heart failure. That means your systolic function is very good here, no diastolic function, okay, no pump failure, no filling failure, etc. So the pump failure is systolic failure, filling failure is diastolic failure. White patients with the worst cases of the congestive heart failure had the lowest vitamin D3 levels. What about the PVD, peripheral vascular disease? 64% are more common in people with low levels of the vitamin D. So the bone health. 55% of all over the age of 50 have either osteoporosis or low bone mass, osteopenia. Okay, so this is diagnosed by your T-score. Minus 2.5 is osteoporosis. Okay, osteoporosis occurs as bones lose the minerals and they become weak, brittle, and prone to break. That means fractures. So 33% of the women between 60 to 70 years have osteoporosis, and 66% of women of over 80 years have osteoporosis. So osteoporosis is very common in postmenopausal women. Osteomalacia or adult rickets is clearly associated with the vitamin D deficiency. Bones, they do not harden, resulting in the softer bones. Vitamin D's primary role is to ensure that calcium is metabolized in the body and deposited in your bones. Vitamin D deficiency may only allow you to absorb 1/2 to 1/3 of the calcium that you would absorb with healthier vitamin D levels. So the poor absorption of the calcium and the phosphorus from the intestines in the presence of the lowered vitamin D3 levels, so leads to hypocalcemia, hypophosphatemia, and hyperphosphatemia. What about the chronic pain? The following types of the chronic pain could be associated with the insufficient levels of vitamin D: unexplained muscle, joint, or the bone pains. So as you fibromyalgias, or polymyalgia rheumatica, or a diffuse pains, okay, or functional pains. So these are all very common here. Various studies suggest that 70% of those with a chronic pain have the sufficient vitamin D3 levels, have insufficient vitamin D3 levels less than 20 nanograms. So for all these purposes, we need vitamin D3 above 30 nanograms. Less than 30, so definitely more associated with the cancers, heart failures, hypertension, okay, and also different immune problems or cold, osteoporosis, etc. Now the autoimmune diseases. So autoimmune diseases are more common in the women. 80 to 100 diseases are autoimmune related. A lot of the diseases are clear. You all know different autoimmune diseases we discussed last month. Autoimmunity means that the immune system becomes faulty and attacks the body it is meant to protect. So the own cells acts against the own cells. Okay. So the endocrine system, type 1 or insulin dependent type diabetes or type 1 diabetes, they strong less with the vitamin D deficiency in the infants because they have the antibodies your islet cell antibodies or pancreatic antibodies. Okay, so these are because of these vitamin D deficiency will increase these antibodies. Now the nervous system, multiple sclerosis, is strongly correlated with the amount of the sunlight. Joints like rheumatoid arthritis, lupus, etc. Again, there is a good correlation between the vitamin D deficiency and your rheumatoid arthritis or lupus. Now influenza, common cold. So that effects were the seasonal due to how much sunshine people that received. Lack of sunshine in the winter increase the likelihood of contracting the flu. So that is very common in the winter season and the rainy season. Vitamin D has a positive impact on the immune system. Boosts the macrophages. They are the bacteria killing the white cells. Enhances the body's natural antibiotic molecules that exist in the lining of the respiratory tract. So the vitamin D helps you in boosting our immunity. Okay. Higher doses of the vitamin D have shown to reduce the frequency of the respiratory infections in the children. So those people who are susceptible to the respiratory tract infections, so they may lead to the pneumonias and the sepsis. So the pneumonia, sepsis, these are even the tuberculosis incidents that can also be reduced or to be controlled to a better way with the vitamin D levels in the normal levels. So the vitamin D helps in protecting these infections by boosting our immunity. So the vitamin D deficiency levels relate to the specific health conditions. So rickets and osteomalacia about 15 nanograms. Suppresses the parathyroid hormone levels 20 to 30. Intestinal calcium absorption, you need 34 nanograms. To improve the neuromuscular performance, about 38 nanograms. Reduction of the incidence of the internal cancer, at least you have to maintain 38 nanograms of ml for vitamin D3. 50% lower risk of colon cancer, 33. 50% reduction in the breast cancer incidence, 52. So if you see these charts, so definitely we need at least more than the 40 or the 50 or the 60 nanograms of the per ml of the vitamin D3 in our body to avoid all these diseases. So if you could correct the worldwide vitamin D deficiency, suppose if you correct the worldwide, this is a global problem. The first thing we would see is a reduction by 80% in the incidence of type 1 diabetes. 75% reduction in all invasive cancers combined, and 25% reduction in the ovarian cancer. So is Dr. Garland, a vitamin D expert, Cancer Prevention and Control Center, San Diego, University of California. Okay, so he said that by correcting the vitamin D deficiency, about 80% reduction in type 1 diabetes, 70% reduction in the cancers, and about 25% reduction in the ovarian cancers. Now another fellow, Dr. Holick. So he said that vitamin D deficiency is now recognized as a pandemic. It causes rickets in the children, in adults, and is now associated with increased risk of common cancers, autoimmune diseases, hypertension, and infectious diseases. So our thinking of vitamin D3 should be beyond your bones. Okay, as a postgraduate, so you are a doctor for 360 degrees diseases. Okay, on one hand we have the infectious diseases, on the other hand we have the non-infectious or communicable diseases, non-communicable diseases. So this vitamin D is related with both the infectious diseases as well as your non-communicable diseases also. So this is very, very common here. The consequences of the low vitamin D status include increased risk of various chronic diseases ranging from the hypertension to the diabetes to the cancer. Recent data indicate that vitamin D3 is substantially more potent than the vitamin D2. The safe upper intake level of vitamin D3 is 10,000 international units per day. So our Indian government says that at least we need 400 international units a day. Okay, so ideally is somewhere between 400 to 800 international units, but it's very easy to remember as the 1000 international units. Okay, in the same way, vitamin calcium requirement is also nearly 1000 milligrams per day. So the calcium 1000 milligrams per day, vitamin D3 1000 international units per day. So our primary source of the vitamin D3 is the sun exposure. Exposure to just 30 minutes of the sunlight can allow the body to generate 10,000 to 12,000 units of vitamin D3. However, in the summer months, use of sunscreens to protect against the skin cancer decreases our ability to make the vitamin D3. In the winter months, we are not outside enough to generate this amount of vitamin D3. Our modern indoor lifestyle, compared to even 50 years ago, limits our exposure to the sunlight and the opportunity to make more and more vitamin D3. So because of these three reasons, most of the people in the world are vitamin D3 deficiency. So 90% is from sun exposure and the 10% is from the food source. So foods naturally rich in vitamin D, like the cod liver oil, etc., they are not commonly consumed by most of the population. And even if consumed, they do not contain the sufficient amounts. The foods which are commonly consumed, like milk and eggs, are low in vitamin D content. So that is the reason now the commercial preparations are there. There will be the fortification of the vitamin D3 in the milk and yogurt, etc. Even foods fortified with the vitamin D, such as found in the milk, cereal, and the orange juice, they do not contain enough vitamin D to maintain the healthy levels in the blood. Several forms of some diseases, such as the rickets and osteomalacia, can be cured with foods rich in vitamin D. Less severe forms of these diseases often go undetected. But unfortunately, the food sources are very, very meager nowadays. So what is the challenge now? Getting enough vitamin D. Supplements, the third and most practical source. Vitamin D3, naturally produced by the body, the recommended and the purest form of the vitamin D, considered safer than the vitamin D2. Vitamin D2 is a synthetic, not naturally produced by the body, 50% less potent and effective than the vitamin D3, still often prescribed by the physicians. But what is the ideal prescription from your pen? Is it vitamin D2 or D3? D3. D3 should be your prescribed vitamin D3 because it absorbs very fast and it has many effects, not like vitamin D2. Addressing the short, long latency deficiency of the diseases. Symptoms show rather quickly. Examples, the rickets and the osteomalacia. Long latency deficiency diseases, the symptoms take many years to manifest, like the cancer, cardiovascular diseases, CNS degeneration, multiple sclerosis, Parkinsonism, Alzheimer's, dementias, etc. And 20% of the breast cancer cases in the Europe were a result of vitamin D deficiency. Nearly 20% of the breast cancers. Most national nutritional policies are oriented toward the short latency deficiency. So the current daily recommended dosages are 10 times too low. How much vitamin D3 is enough? So the current FDA guidelines, adults 400 to 600 international units as the recommended daily intake. This amount raises the blood concentrations of circulating 25-hydroxycholesterol, the form of the vitamin D measured by the doctors. We don't measure the 125-dihydroxycholesterol. We measure the 25-hydroxycholesterol. This amount is also certainly deficient for those that live in the very northern or southern regions of the globe that have limited exposure to the sun. So two leading vitamin D specialists, they recommend the following levels of the circulating levels: 32 to 48 nanograms per ml. So we discussed it. So how to conquer that several diseases when you are having about 32 or the 48. Okay. To obtain these levels, vitamin D regimens are recommended as 2000 to 5000 units a day indefinitely. So we need 2000 to 5000 units a day indefinitely to make our vitamin, to keep our vitamin D at a level of around 30 to 49 nanograms per ml. 10,000 units a day for several months. Higher dosages up to 50,000 units per 30 days are recommended to target certain illnesses such as the flu at a specific point of their cycle. Monitored by a periodical blood tests, your vitamin D3 estimations. Supplements are now available, but how much is really absorbed from these supplements? The body only absorbs about 10% of any supplement taken in the pill form. So most of the supplements is lost during the digestion. So even though the pill contains about 10,000 units, so finally the absorption is only 10%. So 90% goes without any absorption. However, supplements taken in the oral spray form are almost 100% absorbed through the oral tissues. Spray form of vitamin 3 has other benefits. So in summary, vitamin D is more than just a treatment for the stronger bones. A growing research supports the vitamin D can protect us against many diseases like diminishing the muscle strength and the weakness, osteoporosis, osteomalacia, autoimmune diseases like multiple sclerosis or rheumatoid arthritis or lupus, immunity and energy metabolism, diabetes, especially the type 1 diabetes and also type 2 diabetes, different cancers, gum diseases, oral diseases, they are also associated with vitamin D deficiency, obesity and metabolic syndrome, CKD, infertility. Infertility is also associated with vitamin D deficiency, and a pregnancy eclampsia, that is pregnancy-induced hypertension. How it affects the cancers? High levels of vitamin D may enhance the following body processes. Apoptosis, that is a programmed cell death, is called as apoptosis. So cancer cells lose their ability to die off when they become compromised in some way, causing them to grow uncontrollably. So vitamin D makes the cells that are turning cancerous die when they are supposed to. Cell differentiation. Cells evolve into the specialized cell types. Like normal cells evolve and stop growing when they reach the maturity. Cancer cells, they do not evolve and therefore they do not stop growing. Vitamin D helps make the cancer cells evolve and mature into the cell type they are supposed to become. Cell proliferation, cell growth and the division. Genes that control the cell division are affected by the vitamin D. If vitamin D levels are the low, the ability of the genes to affect the cell growth are impaired. So that's how the vitamin D affects in your apoptosis, cell differentiation and cell proliferation. And then regulating the cell growth. Vitamin D prevents angiogenesis, which is the formation of the blood vessels. Cancer cells create a new blood vessels so the cancer can grow. Vitamin D impacts the genes that control the angiogenesis, blocking the cancer cells from creating the new blood vessels, so they cannot keep growing. Then the reduction of the metastasis. Metastasis is the ability of the cancer cells to enter the bloodstream and then travel to the other parts of the body like your lungs, lung mets, or even liver mets, or in the spinal mets, etc. So animal studies indicate that vitamin D may inhibit the ability of the cancer cells to spread this way. So that reduces the metastatic load or the spread of the metastasis to the different parts. So that is how the vitamin D helps in the cancers from all the situations. So from the apoptosis, then the cell differentiation, it has a role in cell proliferation, regulating the cell growth, and finally reduction of the metastasis. Then the cardiovascular diseases. These vitamin D receptors in the blood vessels, vitamin D may relax the blood vessels. So relaxing the blood vessels means vasodilatation. So vasodilatation is helping, whereas vasoconstriction is damaging. So and thus reduce the blood pressure. So more the relaxation of the blood vessels, more the vasodilatation, your blood pressure will come down. So that's what your amlodipine will do. So amlodipine will act on the peripheral vessels as a vasodilator. Vitamin D also has an anti-inflammatory properties. So this may benefit those with the congestive heart failure. So there are all the proposed ranges Already I told you the severely deficient, less than the 10. Deficient, about maybe 10 to 20. So insufficient is 20 to 30. Suboptimal is 30 to 50. Optimal is 50 to 80. Excess is more than the 100 or 150, etc. You need not remember these things. You remember as the 10, 20, 30. And 50 is the optimal, 100 is overdose, and more than 150 is the toxic. See, the disorders produced are aggravated by the low vitamin D status. See, osteoporosis. What is your strength of evidence? Too much. False vitamin D levels associated. Type 1 diabetes associated. Cancer, very much. Autoimmune diseases, yes. Hypertension, periodontal diseases like oral problems, multiple sclerosis, neurological. Susceptibility or poor response to the infection, your tuberculosis or influenza or COVID-19 or osteoarthritis. So the variety of the disease, almost all diseases in the body are somewhere somehow related to your vitamin D levels. See, calcitriol, that is a 125 dihydroxy vitamin D3 called calciferol, is the most biologically active form of the vitamin D that does the following functions. It controls the bone metabolism, modulates the neurotransmitter and neurological function, so helps in neurology, has immunoregulatory function and can decrease the inflammation, so helps in autoimmunity, moderate the transcription of 200 genes, particularly those affecting the differentiation and the proliferation. So that's how in the oncology. So this 125 dihydroxycholecalciferol, the most active form, helps in bone metabolism, helps in neurological way, helps in to boost the immune systems and also to prevent the cancerous transformation of our cells. So very good properties of your most active form of the vitamin D3. So extrarenal production of the 125 dihydroxycholecalciferol. So I told you, so nowadays not only from the kidneys but also from the many tissues and the organs also produce most active form of the vitamin D3. So 1-alpha hydroxylase detected in the skin, vascular smooth muscle cells, monocytes are the macrophages, lymphocytes, lymph nodes, colon, pancreas, adrenal medulla, brain, placenta, prostate cells, and the breast cells. 1-alpha hydroxylase in the tissues functions well below its maximum rate. The amount of the calcitriol that enzyme can produce locally depends on the availability of the precursor compound, that is our 25 hydroxycholecalciferol from the liver. So from the liver, it attaches to your vitamin D binding proteins, then reaches to the kidneys. So these are the different studies specific related to your CVD. A Luric study from Germany, health professional follow-up study, Framingham offspring study, women's health initiative, Australian study in the hypertension, diabetes. So these are the different studies are there. So all these studies undoubtedly they say that vitamin D is very, very much helpful to reduce these problems. So this is a health professional study. See, the men with intermediate levels had 60% more MIs than the men with sufficient levels. Too high caused the CVD. Vitamin D intake, hypertension. Higher intake of vitamin D is not associated with the lower risk of the incident hypertension. So hypertension and vitamin D inversely proportional. So the lower the vitamin D levels, higher the blood pressure. Again in the diabetes, it is very much related with your vitamin D deficiency. Vitamin D deficiency has been associated with the decreased beta cell function. So decreased beta cell function will lead to your insulinopenia. So the insulinopenia will lead to more and more hyperglycemia. So that's how vitamin D is related. So vitamin D is directly related not to with your insulin resistance. Here it is associated with your beta cell functions. And vitamin D, obesity Again, that obesity means more and more insulin resistance there. So insulin sensitivity as much as 60% higher in individuals with the serum levels. Vitamin D deficient participants without DM had higher and post-glucose challenge blood glucose values, consistent with established literature. A potential role for the serum level of 25-hydroxycholecalciferol in the promotion of insulin sensitivity and the prevention of the diabetes mellitus. In men, although not in the women, higher baseline vitamin D3 reduce the risk of incident diabetes by 72%. So in type 2 diabetes also. So when there is a reduced vitamin D3 levels, there is a high chances of getting the type 2 diabetes. Combined vitamin D and calcium supplementation may have a role in the prevention of type 2 diabetes only in population of high risk. So our Indians are at high risk of getting the type 2 diabetes. So that is the reason we prescribe vitamin D3 in most of our in diabetic individuals at least once in a month. Okay. How it protects CVD protection? So inhibition of the vascular smooth muscle proliferation, suppression of the vascular calcification, downregulation of the pro-inflammatory cytokines like your interleukins 1, 2, 6, etc., and also tumor necrosis factors, upregulation of anti-inflammatory cytokines, okay, like your adiponectins. So more and more adiponectin, more healthy. So you will have less diabetes and less cardiac problems. And adiponectin deficiency will have more diabetes and more ischemic heart diseases. The action of the vitamin D as a negative endocrine regulator of the renin-angiotensin system. So vascular smooth muscle expression, I already told you, decrease the vascular calcifications. So these are all very important. Low levels of vitamin D3 have been recently linked to the presence of cardiovascular disease, hypertension, and metabolic syndrome. Results of the recent nationwide investigation showed an association of low vitamin D3 with important cardiovascular risk factors. Levels of vitamin D and cardiometabolic disorders, systematic review and meta-analysis. If the relationship proves to be causal, interventions targeting the vitamin D deficiency in adult populations could potentially slow the current epidemics of the cardiometabolic disorders. So early supplementation of vitamin D appears to help to prevent the type 1 diabetes. In patients with advanced chronic diseases such as heart failure, circulating calcitriol predicts the mid-term mortality better than the 25-hydroxy dosages, which may be difficult to escape by simple vitamin D supplementation. Now the dental caries, so they are also very much involved here. More than 90% of the studies concluded that supplementing the children's vitamin D prevents the cavities. The evidence on gingivitis and tooth loss suggests that vitamin D influences oral health by decreasing the inflammation. So there are all the cancer mechanisms already told you, your apoptosis, differentiation, metastasis, etc. Breast cancer. Women with vitamin D more than the 50 had a 6-fold reduction in the breast cancer risk compared to the women with less than the 50. Okay. Melanoma, that is your skin cancer. Higher vitamin D was associated with the 46% reduction in the relapse of the melanomas. So the lower the vitamin D, more chances of having the skin cancers, melanomas. Same the non-Hodgkin's lymphoma, kidney cancer, colorectal cancer, pancreatic cancer, prostatic cancer, cancer prevention. It is projected that raising the minimum year-round serum vitamin D3 to 40 to 60 nanograms per ml would prevent approximately 58,000 new cases of breast cancer and 49,000 new cases of the colorectal cancer each year if you keep the vitamin D3 levels between 40 to 60. Okay, so there will be much more reduction in the cancer incidences. Vitamin D, vitamin A, and cancer risk. Increasing the sun exposure and cancer risk. Increasing the sun exposure, increase the squamous cell cancer, about 1,500 deaths per year. But the decreasing the sun exposure, breast cancer, 50,000, colon cancer, prostate cancer, ovarian cancer. So it is always better for more skin exposure rather than the increased squamous cell carcinoma, melanomas, schizophrenia. So that is the mental health. So again, the vitamin D3 is related with the schizophrenia. So it improves the mood, reduces the tremors, may reduce the amount of the antipsychotic medications needed, and helps to prevent diabetes and the metabolic syndrome. Type 1 diabetes, already told you. PCOD, vitamin D3 and PCOD. About 120 untreated women with polycystic ovarian syndrome. Median is 28 years. Low levels of vitamin D are found to be associated with insulin resistance and obesity. In all the subjects, concentrations of vitamin D3 were inversely associated with the body mass index, body fat, POMA-IR, that is insulin resistance, hyperinsulinemia, and level of the leptin. More the leptin, more the damage, while being positively associated with the HDL cholesterol levels. Lung functions and asthma. You name any disease in medicine, so there is always the role of vitamin D3 there. Okay. See, lung functions and asthmatics. Okay. Childhood asthma. Higher levels of vitamin D are correlated with improving the lung function. So sunlight and the multiple sclerosis. Influenza. See, the winter more cases. Spring, summer and autumn less cases. The testing can easily be justified in all patients giving the prevalence of the deficiency. So you have to test the vitamin D3 levels from tomorrow onwards. Get the vitamin D3. In which cases? The cancers of these, all the cancers are lymphomas, all hypertensives, schizophrenia, depression, PCOD, your vascular headache, migraine, epilepsy, osteoarthritis, both type 1 and type 2 diabetes, fibromyalgia, all autoimmune diseases like RA, SLE, etc. Osteoporosis and osteopenia, and patients with the symptoms of musculoskeletal pain and low backache, muscle weakness and loss of balance, and systemic inflammation. The average adult intake of vitamin D is 230 international units daily, according to a study reported in the Journal of Nutrition Reviews. So, Professor of Pediatrics, Bruce, at the Medical University of South Carolina, calls the usual supplement of 400 international units a day a joke. So, we need much more than the 400 international units. These are all the food sources. Mushrooms also having much of vitamin D3. See, the fish, cod liver oil, egg yolks, milk, orange juice, cereal, butter, chocolate mixes, fortified foods, and mushrooms. So these are all the different foods. Sun exposure, supplementation. Use D3, cholecalciferol, rather than the D2, that is ergocalciferol. So be careful while prescribing the vitamin D3 to your patients. Always prescribe the vitamin D3 rather than the D2. Dosages should reflect the physiological requirements and the natural endogenous production, and should be in the range of 2,000 to 10,000 units per day. Supplementation should be continued for about 3 to 9 months. Vitamin D levels do not plateau until the 3 to 4 months. So they don't come to the normal levels within a 1 month or the 2 months of your therapy. So you have to wait for a minimum period of 3 to 4 months, like your thyroid profiles or like your HbA1c. So HbA1c once in 3 months we get it. Thyroid profile also once in 3 months, at least TSH. In the same way, vitamin D3. So don't get the vitamin D3 within 1 month or the 2 months of the initiation of your therapy. Wait for about 3 to 4 months. Most studies of the vitamin D supplementation have been flawed due to the insufficient therapeutic intervention. Vitamin D level should be monitored to assess the effectiveness of the therapy by measuring the 25-hydroxycholecalciferol. For maintenance, persons with adequate vitamin D levels. Adults without the sun exposure, like all of us, should receive 2000 to 3000 units of vitamin D daily, possibly more also. So we need 2000 to 3000 international units a day. Pregnant women without sun exposure, they should receive 2000 to 3000, much more. Infants should receive 1000 units daily and older children 2000 units. Present recommendations of 200 to 600 units are very, very inadequate. So thank you very much for your patient hearing.